All right, so now I'm going to introduce our next speaker, Dr. Aleisha Swartz, who spoke to us yesterday. Today she's going to talk about saving lives and targeting efforts through data. Just a little note as well, and this may be an out-of-date note, so I hope it's not, but I've been told to advise you that the book Every Nose Counts, Using Metrics in Animal Shelters is available for sale. I'm not sure if it's sold out, there were not too many copies, but it's a really good book. So if there's not a copy at the G2Z stand, might be one that you want to order. Because if you're thinking, we've learned a lot in the last 2 days about why it's really important for shelters and rescues to look at their data and interrogate their data. Not everyone's really mathsy, not everyone's comfortable around numbers. This is a book designed specifically for people working in shelters and rescues so that you can figure out what numbers to look at and what to do with those numbers. So it's a very good resource. I'm going to hand over to Dr. Swartz now. Thank you.
All right. I highly recommend the book. So if there are still copies left and you're ready to take your data analysis and collection to the next level, definitely check out that book. It's a really great resource. They've broken it down really nicely. So please be sure to check that out. And for those of you who might be settling in, trying to find a comfortable position to fall asleep, because we're going to talk about numbers, or you're thinking I might sneak out and take a break and get some sunshine before lunch, I want to alleviate you of the concern about being buried by numbers. I'm not a statistician, I'm not an epidemiologist, I'm a veterinarian. I'm a veterinarian who was in practice for a long time before I went into academia. And I like to have practical solutions. So I want to have a practical application. Whenever I go to a conference, I want to have something that I can take home and do. For me, that tells me how great the conference has been. I feel like there has been a lot of really good and practical information that has been delivered here. And I actually think it's really great. It kind of ties in very well with Katina's talk and some of the other talks that I've heard, talking to you about your data and do you know what your data is and what do you do with it and how does that target what we do so that our limited resources are applied most effectively. And so my objective, I already said, is to give you some practical tips. We're going to talk about this in a basic level. Some of your shelters may be doing really advanced data, but what surprises me is how often I walk into a shelter and ask some really basic questions, and people don't know the numbers. Or maybe the director does, but the veterinarian doesn't, or your staff doesn't. And most of the time, the people who are collecting the data are your staff. So this is important, something to train all of your staff about. You are more likely to get good data if your person who's doing admissions or intakes knows why it's important and why it matters, not just from the top. So the first thing is, where do you start? So what do we need? What data do you need to even begin? And the key things. So from there, what are the important parts? A lot of times people understand, I get it, I understand it's important, but I don't even know where to begin. The good news is if you're using shelter software, a lot of times it'll do it for you. So you don't necessarily need to reinvent the wheel. But even if you don't have shelter software, there's some basic things that you can start recording and do. And then what do I do with it? So there are a number of shelters, as I already mentioned, that collect a lot of data, but they don't use it. And there's a lot of value there. But we have found, for us, keeping it really simple. Again, I'm not a statistician. I have basic metrics that I know can truly make an impact in what we're doing in shelters. And so keeping it really simple is just fine. You can get very complicated, but you can also do a lot without getting very complicated. And truly, there are things that we can measure that affect our life-saving impact. There are many things that we can do to improve the quality of care that we're giving and improve life-saving outcomes. So I highly encourage you, if you're not looking at your data and you're not sharing it with your staff, to take home a few things, start doing them one step at a time. The analogy of momentum is perfect. Just start little bits, little tiny pieces of information. So our program at the University of Wisconsin partners with the University of California, Davis and Maddie's Fund to have a fellowship program for practicing veterinarians in shelters. It allows us to get together with veterinarians who are working every day in shelters. We do phone calls once a week. We get together a couple times a year, and we collaborate. And they learn from us, and we learn from them, and we share with one another. And our fellows all do a project. So they come up with a project in their shelters that they want to focus on for a year. And this past year, we were lucky enough to have a fellow from Australia, Anne Enright in Victoria, participated in our fellowship, and she got up at 3 a.m. to join our phone calls and share with all of us. And she did some really amazing things. So I'm really excited to be able to share some of that with you, and I think it relates really nicely to this talk about data. But it doesn't start in a nice place. So literally, this slide came from Anne, and a presentation she did at HSUS Expo. And her notes in the speaker notes section of this says, probably the worst place I've worked in. So this is how she came to us during fellowship. She walked in, first day, imagine what you find is rows and rows full of cats and kittens. Every possible space has got a cat in it. You've got wire crates popped up and set up. And this is a common picture all across the US. I'm sure that it happens plenty here as well. We know how tough kitten season can be, and we want to help them all. And so we take them all in. And unfortunately, what happens is many of them are sick. So in Anne's shelter, when she came in, she estimated that 90% of the cats had some form of upper respiratory infection. 90%. That's amazing. That's a lot of sick cats. It's hard to do anything when you're medicating cats with doxycycline and eye ointment constantly. And wow, she couldn't even believe it. She was like, holy moly, what do I do? How do I even start? And she asked, why is this? And they said, well, this is how we've always done it. We medicate the sick cats with medicine. That's what we do. And the question is where do you start with this? Do we need to change our antibiotics? Do we need to look at our vaccine protocols? Maybe. Do we need to work on our sanitation? Perhaps. But there might be some other interventions because of what we know about feline URI, or cat flu, as you call it. But I'll talk tomorrow about influenza in cats, so I have a hard time calling it cat flu. So upper respiratory infections in cats. And when we get started, there's some questions we might want to ask about this shelter. So we might want to ask things like, how many cats are in the shelter? How many cats are affected? Well, she said 90% of the cats are sick. Whoa. How many cats do you take in over time? How old are the cats who are sick? Do you have all kittens or do you have all adults? Do you know what your population looks like? What happens to the cats who come into your shelter? And this shelter had a pretty good live release rate. So these cats are getting adopted, but a lot of them are getting sick along the way. And a lot of us who come into this because we love animals, we want to care for animals, we don't want to take animals in healthy and make them sick in our care. We should be able to do better than that. So I like to think of data as a history for the shelter. So for me, I look at the shelter as my patient, as opposed to when I was working in a shelter where an individual animal might be my patient. I look at the shelter as my patient, and the data is like a history. And I was taught in veterinary school that a history is really important. And when you have the luxury of having a history, just like a behavioral history is really important, and we shouldn't overlook it and we shouldn't dismiss it. The same thing goes for when you're looking at an individual animal for a medical problem, and a shelter when we look at when we have a problem, how do we do some intervention? So data is a really good place to start. So there's some basic data points that most shelters, all shelters, should really collect. We're going to go through these in a little more detail, but we want to look at intake numbers. We want to know how many animals are coming to us and all the information about them. We want to know what species, because species is important. Our interventions might be different. We want to know what age. We want to know how they come to us. We don't know where they're coming to us from. We want to know what their outcome is, so that we can continue to make progress towards more life-saving. Things happen over time. We all know seasons change, and that changes in our shelter. We want to know how many animals we're caring for at any given time. And we also want to think about what programs we offer. Different shelters offer different programs, both within their shelter and also to their communities. So these are all important things to think about. So in a shelter, they say everything starts at intake. That person working that front desk, taking that information, is really critical to getting you good data. So again, like I said, you want to make sure they're trained and make sure you share with them why this is important. Despite all the different outcomes, everybody walks in and comes through that point of intake. And I'm going to give you an analogy to think about, and we'll come back to it later. But imagine at this hotel, if they didn't take reservations and they had no idea who was coming and they didn't track any of that information, and we all just showed up. How hard would it be to run a hotel if you had no idea how many people were going to show up on any given day, any given month? How do you staff it? How do you plan? So think about that, and we'll come back and talk about it a little more. But intake and capturing that information is really important. A lot of shelters, I would say the number one thing people do collect is intake data. So if you know a number in your shelter, you probably know your total intake. If you were gonna know one number, most people, that's the one number they remember that gets on all the brochures and everything. But our interventions for all of these species are really different. The solutions to cat overpopulation is completely different from owned dogs. And so we need to separate them by species. And to me, total intake is not all that helpful. Really, I want to know how many cats you're taking in. I want to know how many dogs you're taking in. Do you have a lot of rabbits in your shelter? What are the species of concern? Because the interventions are going to be different. Cats are not small dogs. And just like Katina said, we may approach cats differently. And sometimes that's not fair, and sometimes it might be appropriate. Age matters as well. So our interventions are going to be different if kittens are a large part of our intake. Spay-neuter programs or desexing programs are really common, great prevention programs. And if we're dealing with lots of kittens, then it seems to be logical and makes sense that we want to focus our efforts on sterilization if we are taking in lots of kittens. Many shelters in the US, especially in the northern US, don't have many puppies, and some don't even have many kittens. Like, they have made that much progress, and that's great. But what that tells us is perhaps sterilization may not be where they need to focus their efforts in the future. We don't want to stop doing what we've done, but there may be other interventions that have more impact. So knowing that the age distribution and the age groups of the animals that come to us might matter. Is it all kittens and no puppies? When she asked the question around the room, not that many people have puppies. Like, that's great. When I was in Atlanta, we were swarming in puppies, lots and lots of puppies. So knowing what your population is really important to guiding your efforts. How do the animals come to you? Do they come in as stray? Depending on if you're a council shelter or a shelter with a contract, or do you only take owner-surrendered animals? Knowing that distribution, do you have a significant number of legal custody cases, in which case you might need to adjust your housing based on that? Knowing animals may come and stay for a long time. Legal custody, animals typically do stay for a long time. Knowing your adoption return rate, and knowing what about those animals. Those things are all important ways to track. And define adoption return. So some shelters define adoption returns as 30 days, some as 2 weeks. Come up with a number and stick with it and monitor it. We work with a shelter in Philadelphia, a municipal shelter, and they look at their numbers and they saw that stray cats were a significant percentage of cats being brought in, and now they sterilize and release and return to the field all of the stray cats that are healthy that come into them. That's what happens with a stray, healthy cat, adult cat that comes into them, is they get returned to the field, sterilized, returned to the field. Boom, now we can focus on owner-surrendered cats. Now we can focus on those cats who are not doing okay outside, who don't have another alternative, and we need to help. Their next level is now they realize a large percentage of the dogs that are coming to them are owner-surrendered. Well, that interventions for owner-surrendered dogs are gonna be potentially different from stray dogs. What are the reasons why owners are surrendering their pets, and what can we do to perhaps help them and keep their pet with them? The more pets we can keep with their people, the fewer pets we have to find homes for. Lots of great interventions based on source. Location is one that probably fewer people are doing, so hopefully most people are collecting the other, but location is really important. More and more, over time, over my career, we realize we always knew our resources are limited, and that's absolutely what you guys said in the last session. Our resources are limited. And so we know we need to be smart about where we use our resources, our time and our money and our efforts. And so by planning and targeting efforts, we realize we have the ability to make a bigger impact. So splitting up, making sure you're collecting postal codes or addresses of animals when they're coming in, knowing the areas that might be of big concern can help you, again, focus your efforts. We're all talking about focusing these efforts so that we get the most with the limited resources that we have. Especially if you have a contract, you want to know how many animals are coming from what area. So the other things you might consider if you have areas of high intake is you might consider surrender prevention focused in those areas, outreach events focused in those areas, locations we talked about with parvo yesterday. Maybe that's a place for a vaccination clinic. Outcomes, intakes and outcomes are the things most people are measuring. We talked yesterday about return to owners. We want to know how many return to owners you have. If your return to owner rate for dogs is 90%, like Marin County, then them spending a lot of resources on a program to increase return to owners for dogs is probably not going to be very successful. So we want to know what those numbers are so we can watch them going forward. Are we making progress if those numbers are low and we start a new program, and what we're doing? One thing that is an important metric of kind of shelter health is diet and care, so we don't want to forget that one. We kind of think of our usual ones of adoption, return to owner, euthanasia, transfers. Diet and care can be an important metric for, are we having issues in our shelter that we need to address on the medical side of things, so don't forget to collect that. We all know that time and season matters, right? We have a significant increase in cats during some times of year. So everybody's summer and coming months for you guys, we're heading out of kitten season right now. But our population can significantly change. We can have 3 times as many cats show up at our door during the summer than the winter. One shelter in Massachusetts used time and date analysis and looked at their data to realize, and we talked about this on Tuesday in our workshop, that adopters were waiting 2.5 hours on the weekend to adopt a pet because their staff was trying to do intakes and adoptions. And so they shifted their hours for intakes and shifted their staffing towards adoption on the weekend. The last thing we want is an adopter having to wait 2.5 hours on a weekend. So we might shift our schedules and our staff levels based on what we need. We want to know how many animals are in our population at any given time. Hopefully, if you're using shelter software, it'll tell you this. So we want to know at any point in time how many animals are there. You want to make sure you audit this, you want to make sure it's accurate, and you want to be able to check it later. So you want to know how many animals are at any given day. Just like I said, time can vary. And this is helpful in the time of disease. If you have a disease outbreak, you want to know how many animals you've got, what their ages are, where their housing is. And then programs. So at the University of Wisconsin, we partner with the Wisconsin Humane Society in Milwaukee and participate in the Pets for Life program, the HSUS Pets for Life program. We go with vet students and provide house calls to pet owners in underserved areas. So they use their zip code information for their highest intake areas, and we go into those people's homes and provide veterinary care for their pets to try to help them keep their pets, be better pet owners, take better care of their pets. So they're going to want to monitor numbers. Is that doing anything for their shelter intake? What is that doing in the community? TNR programs are pretty common across the US, and you want to measure your impact. What does that do on the population of the cats? What does that do to your shelter intake? You want to focus your efforts, location again, vaccination clinics, knowing your outbreaks of disease, all of these things. So these are all pretty simple, basic things that you can collect either at the time of intake, while an animal's in your care at a shelter, as they leave, or in programs that you're doing out in the community. So let's go back to the shelter, the cat shelter. So let's take a look at what information we have about them. So the numbers here are heading into the summer. So when Ann started, it was in February of 2016. And you can look at our intake numbers. And our intake numbers are climbing, as we would expect in the summer. And then we look at our adoption numbers. So in December, our adoption numbers are about the same as intake numbers. Okay, that's good. We're doing okay. And then our intake numbers go up in January. Our adoption goes up a tiny bit, but ooh, getting a little worried. And then February, oh boy. And when we look at the bottom line, which is how many cats we have on site, and we started in December with 139 cats, and then in February, 202 cats. I'm assuming we didn't add 50% more resources to care for these cats. We didn't add 50% more adoptions. We just have more cats to care for. And we can see how we kind of got set up to have 90% of cats with URI. That's a lot of cats. And our adoptions are going down. There might be things that if you monitor this seasonally, there might be things that'll affect your adoption rate sometimes of year. For us in the US, sometimes it's back to school time. I'll tell you the time that stressed me out in the shelter the most was right around Thanksgiving time. US Thanksgiving time, that is not a time anybody wants to adopt a pet. Everybody's going to grandma's house, nobody wants to take the new dog there, and it is really crowded. And then a month later at Christmas, everybody wants a new pet. And so if I know those things, if I'm measuring my data and I'm prepared for it, I can make some adjustments if I know ahead of time. But if you're just cruising along and all of a sudden you go from 140 cats to 200 cats, wow, they're all sick. So one way to approach, my goodness, here I am with 200 cats and they're all sick. So one way to approach it is called Adoption Driven Capacity. And there's a good article in Animal Sheltering Magazine, if you just Google Animal Sheltering Magazine and look at this, what's your magic number? Adoption Driven Capacity is figuring out how many animals you should have in your shelter based on your current rate of adoptions. There are things we can do to increase adoptions, but given everything being equal and the same, how many animals should we have? We know that more is not always better. So although it may seem that if you have more choice, more will leave, that doesn't actually work out that way. People tend to get overwhelmed. You hear, everybody's heard stories of I walked in and it was just too much and I had to leave. I couldn't even look. If I'm looking at 200 cats, how do you pick one cat in 200? There are a lot of people who can't pick, and we need to be mindful of that. There's an interesting study about speed dating, and what they showed is when the groups got bigger, and you had short minutes to meet somebody, the bigger the group got, the more people you had to meet, then people resorted to just choosing based on physical characteristics. When the group was smaller, it felt less overwhelming, and you had more opportunity to engage and have a conversation and get to know people. And I think we could all say that in a shelter, that might be our goal, we would like people, adopters, to get to know the pet and a little more about their attributes than just their physical characteristics. We all think that black cat that's awesome, the ultimate bastard cat, is great. And if we are overwhelmed with too many cats, then we might quickly overlook that cat. So to use a coffee shop analogy, thinking of it, we'll relate it to adoptions. If you put more people in that line, it doesn't make your coffee come out any faster. If we put more people in that line, they all have to wait longer to get their coffee. So unless we're doing something, we're increasing the staff, we're increasing equipment, we're doing something to make the coffee faster, putting more people in that line doesn't help us. And the same goes with putting more animals on the adoption floor doesn't increase our adoptions. We have to do other things to increase our adoptions, but having more animals doesn't increase our adoptions. So more people waiting doesn't make the outcome happen any faster. And for a given rate of outcome, so if we have a static adoption rate, putting more animals on the adoption floor doesn't help. All it does is has the animals who are there stay longer and get less resources each, because we have to divide it up more. It's really important to think about, because we want to help them all, but that actually doesn't help. So when we talk about adoption-driven capacity, what we want to do is we want to look at our adoption rate, and we like to look at it month by month, because we know that there's seasonal variation. So we look at our monthly, daily average adoptions. So we take our total adoptions in a month, we divide it by the number of days, and then we multiply it by a goal length of stay. A good goal length of stay is 7 to 14 days. Depending on whether you're owner surrender or you're stray, do you have a hold period, et cetera. So it's going to be variable in there depending on what your organization, what kind of animals they take in, what your stray hold is, all those things. We know that there'll be some variability for age and breed and condition. And we know that we do need a minimum to provide some variety. People do need to have some choice, but just not be overwhelmed. So let's look back at the numbers. So in February, they did 71 adoptions. And so 71 adoptions in February means, and this is so embarrassing, I could blame it on Ann, but I'll blame it on myself. There's not 30 days in February, so I apologize. Most other months, this would be fine, and in the end, it'll average out. But there's not 30 days in February, so forgive me that. But 71 adoptions during the month of February, divided by 30 days in the month, so averaging 2.4 cats. I know you can't 0.4 a cat, but 2.4 cats per day leave the shelter. So if we know that 2.4 cats per day leave the shelter, And their average length of stay was longer than we'd like it, but we'll get there in a minute. So their average length of stay was 28 days. So what that means is their adoption-driven capacity number is 67 cats on site. Now, do you remember how many cats they had on site at the end of February? 200. So putting 200 cats, when we know that 67 is about how many we're gonna adopt out in a month, that's pretty dramatic, right? So what they did is they said, 66 is our magic number. And when we get to 66, we are going to stop. We need to do something. Continuing to take more animals in, more than are leaving, is not helping anybody. It's not helping your staff who's overwhelmed. It's not helping the cats who are getting sick. It's not helping anything. And it becomes a vicious cycle. So when we talk about capacity, it's really important, and I feel like the shift is happening. It's not just about how many empty cages or runs you have. Capacity is more than just the number of beds. Capacity has to do with our ability to care for the animals in our care, to care well for them. I think we all want to do more than just have a cage to live in. So another way to approach what do we do when we're overwhelmed with disease and we have too many animals is we look at length of stay. And Katina brought it up, and actually what was interesting is in the time where everybody had things to talk about and money was a huge problem identified by everybody, nobody talked about length of stay. But we'll get to it in a minute, but huge, huge thing that doesn't cost you anything is to decrease your length of stay. So if capacity is how many animals you can care for at one time, flow is how many animals you can care for over time. So over the course of time. And those are different. Those are not the same. So when we look at capacity, in addition to looking at our physical space, but we also need to add in care, right? So in the US, a commonly cited number is 15 minutes per animal per day. That's for basic cleaning and feeding. And I really hope all of us want more in our shelters than just basic cleaning and feeding. It's not enough. It wouldn't be enough for our adopters. We wouldn't think it would be enough for our adopters. It's not enough for our own pets, so more than basic cleaning and feeding. Then we have supplies too. So these are hard costs. It's not just how many housing units. But length of stay is truly magical, literally magical. When animals spend less time in your shelter, you have fewer animals in your care, and that means each of them gets more. So if you have, instead of 200 cats, you have 67 cats, you have the same amount of staff, you have the same amount of resources, you have the same amount of money, imagine how much more those cats at 67 cats get than 200. And what we know is we know that when we have 67 cats instead of 200 cats, and they stay healthier, we can care for them better, and then they get adopted faster. So they leave quicker. So having more animals there doesn't make more animals leave faster, but having fewer animals there actually can help speed it up. They stay healthier. Do we think our length of stay is gonna stay fast when 90% of your cats have URI? Nope, absolutely not. And since studies have shown, research has shown that length of stay is directly correlated to illness. So we know that 5% increased risk per day for cats for staying in a shelter for respiratory disease. We need to help them, we need to give them what they need, but we need to get out of their way and let them go home when it's time, as quickly as we can. So there's a significant cost to holding animals more time. Dogs have the same, increased risk for longer they stay. So length of stay, if you're gonna come up with one number that you measure of all of those things, you wanna figure out your length of stay from the other numbers. ASPCA Pro has got some really great resources to calculate your length of stay. Also in your notes should be your adoption-driven capacity, an Excel sheet that you can plug in some of your own numbers. But length of stay is a really important number. It is not fancy math. Again, I'm not a statistician. We're talking about the intake date, the outcome date, and what's our length of stay. If you don't measure it now, your software will likely do it. If you don't measure it now, you can start as soon as you get home, walk through, look at the animals in your shelter. Start tracking it. As they are outcomed, then start figuring out a length of stay. You can start now. You don't have to worry about you haven't done it. It's not really complicated. Simple Excel or Google spreadsheet, figure out your average length of stay. Median length of stay is another thing, and it's the number in the middle. And I'll show you, if I change these numbers a little bit, something to think about depending on how your software calculates it. You may just want to ask the people if it's calculated for you. Does it include foster care or not? depends if you outcome to foster care or not. Things that may affect length of stay. Even in the best shelters, some animals need more care. They need to stay longer. Median is the middle number. So in that bell curve of some animals are going to leave really fast and some animals are going to stay longer because they need something, median's the middle number. And when we look at these pictures, it tells you a little bit the challenge of averaging length of stay, but it's still a good metric to start. So it's not perfect, but it's a good starting point, and we can monitor trends. So tiny kittens may need to go and get a little bit bigger and healthier before they have surgery. Cats with broken legs who we'd love to treat, but they're going to need longer care. So their length of stay isn't going to be really short because they need something from us. But your very friendly, healthy dog or 8-week-old kitten, they're going to be ready to walk right out the door. We're literally just going to have to give them a vaccination, hopefully sterilize them, and put them somewhere where they can show their amazing selves. So if I just wanted to share with you, so don't be disturbed if your length of stay is longer than that 7 to 14 days. You have something to work towards. But if you have a lot of animals you're doing extensive rehabilitation on or going to foster care for a long time, your average length of stay may be longer. And you may or may not have the ability to change that in your software program. So if we go back to Anne's shelter and we look at these numbers and we look at length of stay, we know her length of stay was 28 days. A likely impact on that was the cats with URI. We got to get out of this vicious cycle, right? So if her length of stay is 28 days, that gives us 202 cats in the shelter at the end of February. How many cats would we have if her length of stay was 14 days? If we got them in and out, 14 days is a really reasonable time. We would like it way less than that. We would have half the number of cats, like literally just half the number of cats. And I'll share with you what they did, and it didn't cost them any money. And so in all of our time where we are worried about money and resources are precious and finite, there are a lot of things that we can do to affect this. So I really challenge each and every one of you to know what your length of stay is, make your staff know what their length of stay is. And as we like to say, length of stay is chasing you in a shelter. It's keeping animals healthy. Keeping them longer doesn't keep them healthier. For all the shelter directors out there, which shelter costs more to run each day? If you take in 1,000 animals a year or 2,000 animals a year, shelter A or shelter B? Or maybe it depends, right? And for those of you whose mission might be to help more animals, which shelter helps more animals? Shelter A, who has 100 animals on site at any given day, or shelter B with 200? A, B, or it depends. I will tell you, I'm working with a shelter in Montana, and they have had their length of stay for cats in the last year. And talking to them just a couple weeks ago, I told her I wanted to give her a hug through the phone. Their intake is up 25%. We don't always want intake to go up, but this shelter is actually bringing cats in from other communities in need. Their intake is up. The number of cats in their care is half of what it was before, and their adoptions are up 30%. Like this math, it at first is hard to wrap your head around, but it's magical. They have no cats in their infirmary, none. We're talking about using their infirmary for other things. They're talking about treating for ringworm when they didn't used to. They're doing other things. So now this gives you the opportunity to do other stuff while you're helping more animals by just having them stay less time. This doesn't mean you have to increase your funding. So talking about money, the money kind of helps all of us put this in perspective. So you want to look at, what are your actual housing? What do you really have in your shelter? What is your capacity when you're looking at it? You want to look at both how many housing units you have and then also what kind of care, the staff time. Time for enrichment's important as well, right? We know it's not an optional thing. You have to do it. Think about what's ideal. So don't just think about what you have. We know that having more animals doesn't necessarily help us help more. Space and time and all of those things. Enrichment isn't extra. Medical care isn't extra. And then how much do you need? So when we talk about budgeting, what do you do if your resources don't match your expenses? This is the same in your personal life as in your shelter. You could, as that shelter was, spending more than they earn, getting into lots of debt. Our interest is, you can think of as cats with URI, and over time that's not sustainable. It's not a sustainable solution. We're not helping more cats by having 90% sick. And as we talked about, you could panhandle, you could do GoFundMes, you could do a lot of things, so you could try to make more money. But the other thing might be spend less money. Spend less money is a great thing. So let's go back to the shelter and talk about what they did. And pretty much none of these cost any money. They started doing population rounds. So every day, a team of people at the shelter, different shelters have different teams. Sometimes it's the veterinarian, sometimes not. A lot of times it's the manager, adoptions manager, foster care. Whatever team you get, your own behavior people, gather a team, walk through your shelter every day, look at every animal and say, who are you? What do you need? Are you on the pathway? What kind of things do we need to do to keep you moving forward? We're not rushing animals through, but we're making sure they have things they need every day. It's really easy in animal shelters to have animals fall through the cracks. So walk through every day and make sure their needs are met. They stopped holding for multiple vaccinations. So I hope none of you are doing it. I'm not even gonna poll, but they used to hold kittens till they got another booster. Hopefully we learned yesterday, maternal antibodies and interference with vaccination can mean that there's vulnerable times in puppies and kittens' lives that no number of vaccinations is going to protect them. So the thing that will protect them is to reduce the exposure, and reducing the exposure is getting them out of the shelter. So don't hold them for multiple vaccinations. Give them that vaccine when they walk in the door, send them home, and let the adopter follow up and do the vaccines. And their shelter even does the vaccines post-adoption. That made them feel more comfortable sending them on their way. They made cats with mild respiratory infections available for adoption. So do it. It's something that many average cat owner can do. Give medication. They're gonna get better in a home, so do that. We encourage you to do it. Have them visit with them last, but don't think because they're sneezing they can't go home with somebody. They decreased their owner surrender hold. So please, I hope none of you are doing this, but they were holding cats for 8 days who were surrendered by their owner just because. If that cat is happy and friendly and healthy and wants to go home, get them out. We've been working with a shelter in New York City, and we've been challenging them on their length of stay. And their shortest length of stay was 45 minutes recently. It was a really healthy, super friendly, adorable kitten who was already sterilized. It just didn't work in the home that he was in before. And they were able to get that kitten in a home in 45 minutes. That is not rushing that kitten. That's not doing anything bad. We're not pushing him out the door. But what could we do for that kitten for 8 days that they couldn't do in a new home? They were able to, when they made these changes, to improve the healthcare and put cats on an adoption pathway. So they had senior cats that got blood work and got workups and things from the moment they walk in the door. They had a plan. They knew some animals are gonna need more. And by doing this, they were able to keep them healthier and move them forward. They started a foster care program. They started foster to adopt. Sometimes that is a really huge thing to reduce barriers. And then they managed their admission. So going back to that hotel analogy, think about if the hotel had no idea how many people were gonna come and we all showed up. And there was 5 conferences here. And they said, well, I don't have an open room, but this one only has 3 people in it, so why don't you go in there? Because that, you'll fit, you all can smush in. You can share a bathroom, and maybe you can use the bathroom down the hall. And why is it in shelters forever that we think we're helping more animals by saying okay anytime? Shelters all over the US are doing this, and I really encourage you to start trying it, is communicate with the public when you're full, when you're at your capacity, when you get to that 67, communicate with them. They wanna do the right thing. Most people who are bringing cats to you wanna do the right thing. Tell them when you're full. Ask them to hang on to them for a little bit longer. A lot of times they will. Start with baby steps. Little bits can help. It can all help. And they were also able to improve the quality of their housing, which we know is a big factor with cats. All of these little things led to decreasing their length of stay, so they picked their magic number. They also, at the same time, reduced their length of stay. You can start with that magic number, but you can also just work on your length of stay. You will get there. They hardly have any URI now. I remember our phone calls with Anne these last few months, and she'd be like, everything's great. We hardly have any cats. We barely have any. They're all healthy. They moved out the door. We're down from 90% to 2%. Oh my gosh. They were able to transfer in cats from other shelters in need. This didn't cost them any money. So you can go raise more money, but none of this stuff cost them any money. And the staff bought into it. The staff buy into it because, like that shelter in Montana, they're not drowning and taking care of so many cats and sick cats everywhere. And here's their numbers, so the proof is in the pudding. So March was a tough time. Look at how many cats they got up to, 226. One thing that we encourage shelters to do when you get to that point is have a big adoption event. Change your set point, get a little lower, get to the point where you're not so overwhelmed. and then do all those little things, pull all those levers to increase your length of stay. And now they struggle to get up to their 67 because the cats are moving through faster. And so now they're reaching out and they're helping more. So the big thing they did is by having fewer animals at any given time, they're able to help more animals over time. For them, having a magic number really helped. A lot of times we find just working on length of stay will get you to your own magic number without any calculations. So for those of you who are scared of numbers, only number you need is your length of stay. They improved their housing, really important to have good quality housing, and if you have fewer animals, you have the ability to have better housing. They worked on their adoption pathways and getting rid of the barriers. They got a foster care program, and they managed their intake. So they didn't just say, we don't have space, but we'll make space at the expense of getting cats sick. We don't want animals to come in healthy and get sick in our care. We already saw this about the magic of length of stay because it really is magical. And we know that if we have animals in our shelter longer, it puts them at risk for becoming ill. So think about in your shelter, I'll give you homework as well, just like Katina did. What are the barriers to animals having a positive outcome? Are we treating them for shelter-acquired disease? Are they waiting for something to happen? Things like surgery. Well, then let's look at our surgery scheduling and our staffing and adjust. Are they waiting for behavior assessments? Well, the research is showing that maybe they don't need to be, maybe that doesn't need to be a barrier. Maybe our behavior team's time is better spent elsewhere. These things can feed on themselves and they can really cause a backlog and cause the animals to be less healthy. The next level is looking at length of stay for each point along the way. So looking at stray versus owner surrender, transfer. If time to surgery is a barrier, to look at that. Neonates versus adults. One thing that's really interesting talking to a lot of you is that the stray holds are different in the different states, which is great. And the funny thing is, not everybody's aware of that, it seemed like. So that's pretty cool. And that tells you that it's possible to be different elsewhere. So work on things that we think are beneficial, or working on reducing stray holds for animals that are not likely to get reclaimed. So litters of kittens, if 6-week-old kittens are not likely to be stray that are going to get reclaimed, right? So work on your legislation and change things. I know some of you don't have hold for cats and kittens. That's awesome. That's great. You can make exceptions for holding time to things that are not live outcomes, so holding times to euthanasia, or holding times if they have ID. Chicago did it, and a really huge thing. So we really encourage you to do that. If you have hold times, especially for cats, looking at cats and dogs differently, looking at what populations get reclaimed, if you know your RTO rate, that will help. So my goal for you is for you to go home and know what your length of stay is, know what your capacity is, know that it's not just how many cages you have. Make sure your staff know this information too. They need to know how important it is. It really can affect your life-saving impact. I know it seems totally crazy to tell you have fewer animals in your shelter and you will help more, but it has happened over and over again. And we have so many shelters who have just really champion it once they do it. And I really want to say thank you to Ann Enright of the Cat Protection Society for sharing. So it's not easy to get up and say, this was the worst place I walked into as a job. But then to know now what you can do, you know? It could have been really easy to turn around and walk out, but to know you made a really huge difference. And Dr. Carson and Dr. Newberry are capacity for care and length of stay champions, and I've learned so much from them. And I as well am so impressed by this conference and thank everybody so much for the opportunity to come. And I'm really excited about what you guys are doing. I think you're doing great things. And please visit our website. A lot of these resources are there. And that's my contact information if you need it. And I appreciate so much the opportunity to talk to you.
We have time probably for one question, so it's good that we've got one person here.
This is about the second-class citizens, or cats being that. My ideal world for owned cats is access to outdoors in enclosures or in yards with mechanisms which stop the cats being able to leave the property. I know how mortified dog owners are if their dog leaves the property with fear of what could transpire. With a lifespan of 18 years for indoor cats and 3 years for those who go outdoors, and all the risks to their lives such as snakes, other cats, dogs, people, cars, etc., and all the effort that's involved in searching for these cats when they wander, I truly wonder why they're left to roam freely in the first place? Why?
Is this on? Yeah. I'm not sure. So, are you wondering why people do that? I think from talking to clients and people in general, they think it's cruel to keep them in the house. Cats are predators. They need to hunt. They need to go outside. They need to have freedom and sunlight and grass under their paws. And to an extent, I agree. They need to be able to engage in those natural activities. But perhaps we can provide that inside. By enriching the lives inside of the house, we can make their lives humane and appropriate. And I think letting them outside is easier. And trying to change that public perspective, it's cruel to neuter a cat. I take his manhood away. Well, he was never a man to begin with, he's a cat. So I think a lot of it, what we have to do is education and educating the public about how to do these things. Here's an idea for your cat to get exercise, because I know you're concerned about it. And once we can change public perspective, it's gonna be slow. I was talking to somebody about, mine was a generation where we learned about recycling in school. And now the generation that's coming up now is doing an amazing job. So it's probably not gonna happen in our lifetime. But if we can start educating, those families' kids will start doing it. And then their kids, maybe fewer cats will be outside. So we may not reap the benefits now or even in our lifetime, but let's try, and just education.